Any type of mechanism that results in twisting of the leg is again going to be more susceptible to cause a break than just the standard compression that we have from walking around. Welcome back everybody, I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. Deandre Baker broke his femur, the strongest bone in the human body, on what has to be one of the most shocking and truly rare injuries in NFL history. In this video, we'll take a look at what could have happened here and go into some details about this injury. As always, if you enjoy learning about this unique side of sports, please consider subscribing, and let's get started. Here on this play, we can see Baker running down the field to try to cover the receiver. And as he's coming down the field here, he steps forward with his right leg and plants it into the ground, as you can see here that he's grabbing onto the receiver's jersey. Now, this is a risky position to be in because number one, his left leg is extended, meaning his knee is locked, and he's putting a lot of axial load, meaning compression through his lower leg, but he's also falling forward. So he's basically compressing that leg even more, and this is just a really compromising position to be put into, regardless of what the ultimate outcome is going to be. As we continue forward here, he still is holding onto the defender's jersey, and I don't know if he just didn't want to let go or couldn't kind of process things in time, but I almost feel like that holding onto the jersey caused him to be pulled forward even more to put added compression and twist onto his left leg and lead to this injury. As we continue to advance here a little bit, it's tough to appreciate, but essentially here we can see his leg goes from being essentially straight to then whipping out to the left here. And there's likely also a component of some torsion, meaning some twisting in his leg. Again, in this position, he still is holding on to the receiver's jersey. That left leg is now rotated torsionally out to the side. And then if we continue even more here, now we can actually see where that fracture actually occurs to the left femur. As he continues forward, you can see more what I'm saying with this compromising position. His left leg looks like it's still making contact with the ground, and he's essentially forward flexed all the way over at the waist, putting even more awkward load and torsion on that leg, to where then when he comes forward, now you can see how that femur kind of wraps back around to the front. Femur fractures shouldn't occur in really any sporting event, but particularly in a non-contact situation like this, where basically he's just running and plants his foot funny. Nobody came in and hit his leg didn't get rolled up on like we've seen happen with Alex Smith, or like we've seen in basketball with Paul George when his leg got caught underneath the basketball goal and then caused it to snap. He was basically just running and his leg twisted in a way that produced enough force to break the strongest bone in your body. Here what they have on Baker's leg looks like something called a vacuum splint. Priority number one here is to stabilize the injury, try to reduce it if there's a displaced or an open injury, because you don't want to compromise injury to nerves, blood vessels. You want to stabilize this as best as possible. In their normal state, these vacuum splints are loose. You can kind of mold it and wrap it around the limb that you're trying to stabilize, and then you essentially suck the air out of it. And that causes it to basically get really tight with these plastic beads inside of it to form a more rigid cast. So it helps you kind of conform to the different shapes of the limb that you're using, as opposed to just a typical, splint with two pieces of metal. Now, the exact way that the force is applied to the bone actually plays a role in how it could break. If this rolled up piece of paper is our femur, our bones are pretty strong in compression, meaning pushing in from the two ends this way and that way. Bones hold up pretty well. It's pretty hard for me to crush this tube of paper, even though it's just thin paper. But bones aren't as strong whenever you have a direct load at them from the side that causes some sort of bending. So if I've got this piece of paper, all it takes is a load coming in from the side to result in a break. Similarly, bones are not as strong with torsion, meaning twisting. So any type of mechanism that results in twisting of the leg is again going to be more susceptible to cause a break than just the standard compression that we have from walking around. The femur also has a lot of muscles around it. It's very deep inside the big compartment of your thigh, which provides even more cushioning to make an injury even less likely with direct blunt trauma. With Baker, it comes down to evaluating for any underlying pathology that could have made the bone weaker than it should have been. Poor diet with limited calcium and vitamin D can certainly affect bone health. Athletes can have what we call occult fractures, meaning it's a fracture to the bone, but you can't really see it on imaging and it doesn't really cause too many symptoms until it's severe enough to cause a break. And there's even different bone tumors that can make the bone weak. to where the only time you discover the bone tumor is after you break the bone and then see it on imaging. The repair of a fracture like this almost always involves a procedure called intramedullary nailing or an intramedullary rod. The inside of the femur here is called the medullary cavity, and what they'll basically do is take a metal rod and either from the top up here or from down below, insert a rod back inside those two pieces of the fracture to help get the bone back in proper alignment. It may surprise you though, but these athletes can return to play even with an injury this severe. What it always comes down to is the other associated injuries that they have to things like nerves, blood vessels, and then any resultant injury or damage to the muscles, either as a result of the surgery or the injury itself, that while even though the bone has healed up just fine, could still affect their ability to play at a high level. Your first thought when you see something like this really has to be, was there underlying pathology to the bone? Because even with these different positions with the torsional load, with increased axial load, those are things that athletes are subjecting their bodies to on a pretty common basis with doing squats and doing their drills. So priority number one has to be to look for any underlying abnormalities that make the bone weak. As we go back through this one more time again, he plants with that left leg. That's likely causing some hyperextension, which is going to increase the axial compression through the femur. As he's pulling onto the jersey here, that's probably going to increase a little bit more. And then as we see his leg come out to the side, this is likely when there's some torsional component that's probably imparted through the femur, which then of course leads ultimately to the break. After watching Alex Smith lead the Washington football team to the playoffs after his injury, I mean, anything's possible. And so this is a perfect time for guys to really be inspired and motivated to get back despite having such a bad injury. So I hope that Baker's able to use that story as a little bit of motivation and inspiration for his own recovery. That's it for the video, everybody. Thank you as always for watching. Let me know any questions or comments down below. And until next time, we'll see you later.